life. Today's lesson, the incredible power of listening, is a treasure chest that predicts the success and the outcome of a therapeutic relationship. Learning to listen. And as we segue into the conversation about this today, we all think of what's going on today in our culture. Dr. Scalise, they're doing research on what's called IAD, the Internet Addiction Disorder. And it is an amazing distraction. And what we need to help our students understand that listening in the counseling office is profoundly different than listening in a conversation.
Oh, absolutely, because it's not a passive process. Sometimes we think of listening as I'm just sort of passively sitting back, and no, to really be an effective listener is a very active process. And I have learned that those counselors who are the best listeners are the best counselors. And it really is a critical skill to have. We live in probably the most technologically advanced and sophisticated culture ever, yet in many ways we are in the most technologically connected society and culture ever, but we, I believe, are in the most relationally disconnected culture.
Isn't it interesting that it's the very technology that increases the barrenness of a heart that needs to be heard and understood?
Right.
I mean, you have seen as well as I have in restaurants where this couple's together, sometimes the family's together, right?
Yeah.
And they're out to dinner, and mom is on her iPhone, dad is on his iPad, the kids are doing their
No
stuff.
one's talking, no one's connecting. And so if you think about counseling, the entire, what we've been talking about in laying the foundation is to have an environment that says, talk to me, connect with me, because that is the essence or the foundational core of counseling. And so what we're going to be talking about in this particular session is some specific techniques about listening, some of the things that hinder or are barriers to effective listening, some of the differences between how men and women communicate and listen. And so all of these things are critical for you as you develop into a competent counselor.
And remember, our point is that listening is a treasure chest that enables us to segue meaningful into relationships. Without listening, there cannot be the cultivation of a meaningful and lasting relationship. The Bible teaches a lot about talking, but about 70% of what the Bible teaches regarding communication is negative. Warning after warning, and perhaps the book of James is the best illustration, coming from James chapter 3. And James illustrates the power of the tongue in a negative way, like it's harnessing a horse, or the rudder of a great large vessel, or a fire out of control. And then the Bible says a really wise man is a man who has the ability to harness the power of the tongue. But today, people are crying out to be heard and not talked to. And if I may repeat it, listening as a therapist is substantially different than listening in a conversation, because just like you and I can illustrate here, I can be talking, or when you're talking, I'm thinking about what I want to say next. And isn't that true in social groupings?
Oh, absolutely. But that actually is a barrier to listening.
Yeah.
Yeah. And so why don't we maybe unpack some of the nuances of communication and walk through some things. You, as a counselor, may see individuals, couples, families, which means you may be working with same-sex clients, opposite-sex clients. Again, there are cultural nuances in terms of communication, and you'll get a lot of that in a multicultural course. But I think just understanding some basic differences between men and women, because men and women do communicate differently, and depending on who your client is, and if you have a family or you have a couple, you have to figure out how to connect with each person sitting there in front of you. For example, men and women, God created us biologically different. An event happens around the 7th week of gestation in a male fetus that doesn't take place in a female fetus. It's called testosterone flooding. Most of you have heard of this rather powerful hormone called testosterone, and it's released in the growing brain around the 7th week of gestation. And what it does is it actually compromises some of the connecting fibers between your left and right hemispheres. That band of fibers is called the corpus callosum, by the way. And women have about 40 to 50% more connective fibers or tissue between the two hemispheres of the brain, which means they can transition a little bit easier because of biological hardwiring between the thinking and cognitive and analytical side of the brain and the feeling, creative, emotional side of the brain. Whereas men tend to operate a little bit more in one side of the brain or the other. And so that's an important difference. Other differences, and Dr. Ken, step in any
Well, I just
time.
want to, what you just explained is I interrupted you. No, but what I just wanted to make sure is when a woman says, but that's not what I meant. You know, she will say something to you, and then you, as a man, you think you get it, and then so you respond as though you know for sure what she's saying, and then you act that way. She comes home and she says, I can't believe you did or didn't do this. And she said, and so the man says, hey, well, what can I do to help? Nothing. Just leave me alone.
Right.
So he does. He leaves her alone because that's what.
Not understanding the message about the message. And when you're talking about the message about the message, that's called meta communication. It's communication about the communication. And so, you know, helping couples, you have to help couples decipher you know, the communication that's going on between them, and same in a family. But you as a counselor also need to be able to understand some of that. Other differences, cognitive, and these are broad brushstrokes, so understand that we're speaking broadly, but cognitive differences, men tend to think more vertically and in terms of power and position. Because of this hormone called testosterone, we are a lot more competitive. And so we always are thinking power and position. Am I better than, worse off? Stronger than, weaker than? Greater than, less than? And so we tend to think in a vertical hierarchy, above and below, better, worse. But women don't necessarily think in terms of...
That's not their context.
That's right. They think a little bit more horizontally, which it's more about, am I close or am I distant within this relationship? Am I connected or am I disconnected? And so, again, you see a little bit of the differences. And so we tend to think win-lose, right? Men are oriented that way a little bit more. Women tend to think win-win a little bit more. I actually believe that if you had more women who were heads of state, presidents, prime ministers, and so forth, there would probably be less conflict globally. However, if there ever was one, it could get quite interesting.
Sort of a good news, bad news, right?
Right.
Application.
Yeah. So men think independence and separateness. And women tend to think a little bit more interdependence and connectedness. You know, I often say that to husbands, and this is an important communication thing, that their wives don't necessarily want them to solve their problems. So we're problem solvers, again, broad brushstrokes, and so we come in and communicate when our wives say, hey, this is going on, and we start throwing out solutions. Well, honey, how about if you, and she says, you don't care. And it's like, but I just gave you some wonderful suggestions.
Come on, did you not pick up the wisdom of what I just said?
And so it's not like they want us to solve it. What they want is to be able to verbalize what they're feeling and thinking going through in our presence. Somehow that feels like there's a connection, and that feels right. Men, on the other hand, what do? We want to go to the bat cave and push buttons and get alone and think and plan. And so we tend to disengage when we have conflict or big decisions, and sometimes women misread that communication as, you know, you're rejecting me, when it's not necessarily that. Women speak more words than men, about twice as many words. So I tell men all the time, you better save some words if you're married and you come home, because a lot of women spell love T-A-L-K. A lot of men spell love S-E-X. And it's not about something dirty or dishonoring. It's partly about how men and women perceive and understand closeness and intimacy and those kinds of things. So it's important that we understand some of the differences between men and women as we're listening to their story and having interaction with them in the counseling setting.
So as we're getting started here, we wanted to just remind you that there are some bad habits, we'll talk about those in more detail, that are consistently noticed in a social relationship, an interpersonal relationship that does not work well in the counseling office. And I've listed a couple of here. We tend to finish somebody else's thought. Honestly, if you watch in a conversation, you're not listening so much to what they are saying, you are preparing your response. And what really gets us sometimes is we're saying something that we're quite impressed with, or we wouldn't be saying it, right? And you can kind of see the person you're talking to zoned out or not cluing in to what we're talking about. And then they interrupt, finish your thought, and one of the most frustrating times, especially if I'm trying to tell Dr. Scalise a joke that he's heard before, and I'm really revving up to the punchline, and then he laughs and smiles and finishes the joke. Now, he doesn't really do that, but I just thought I'd give you an illustration. So people who are in a social context are not intentionally listening. They don't understand the treasure chest of information and relationship connecting that directly resonates from the discipline and the practice of intentional listening.
Yeah, part of that, before you go on to the next point, Dr. Can, is the fact that we think 4 times faster than we talk.
Exactly. Yes.
And so because our brains are these marvelous organs that God has created, the natural tendency is, as a person is talking, is our mind often goes ahead of the conversation.
Yes.
We draw our own conclusions and we're formulating potential responses while the person is still talking. And so that's why I'm saying intentional listening is really it's work. It's a focused thing, because our natural tendency is to be on, I'm with you, off, I'm ahead of you, or I have all this extra time because I think 4 times faster than I talk, and so I've moved ahead of the conversation.
And I want to say too, Dr. Scalise, it's not either or, it's both. For example, how awkward would it be in a social group if you're sitting there and you're just staring at the other? I think I understand, or I'm picking up what you're communicating with me. Socially, what you just described is an appropriate way of communicating in the context of a rapid-paced lifestyle and multitasking and a myriad of issues that are crossing your mind while you're having a conversation.
Yeah, exactly.
And I want the students to understand that it is very different in how we listen.
Another potential barrier is when you have emotion or strong emotion within the context of what's being discussed. I often refer to that as red flag listening. It's kind of like waving the proverbial red flag in front of the bull. And all the bull sees is the red flag and the emotion. So whoever we're talking to or whatever we're talking about brings up so much emotion that I'm now focused on what I'm feeling and I'm not really hearing the content. This happens in arguments between spouses and conflicts within homes and between relationships where emotion gets in the way of effective listening.
In fact, I have 3 words that I've written down in my notes that kind of capture the essence of what you've just said. The message that's sent, the mood, that's the emotion of the message, and then the meaning of the message. If you kind of watch the sequencing of that, the message is the content, the mood is how it impacts you emotionally, and then the actual meaning of the message gets lost in the process. What I have done actually in marriage therapy is when I have a couple that are having difficulty with communication, on occasion I will say to them, because some of the things you've already described in terms of barriers, Dr. Scalise, are just causing disruption. They are sincere, they're not cantankerous people, they just don't know how to get it done.
Right.
So I'll say to them, hey, I want you to call your wife. I want you to go upstairs, get on the phone, call your own number. There's a way to do that. And I want you folks to have a conversation together for an extended period of time. And then I usually ask them to create an agenda that is somewhat contentious or difficult. And I'm not exaggerating to say that after they've exercised that opportunity, it has made a substantial difference in breaking the log jam in resolving the conflict issue. A wife has said to me, I just love it when my husband travels to do his conferences. And I say, what? And she'll say, yeah, because when he's away, he calls and we just talk for an extended period of time on the phone and he's in one city and I'm at home. Why do you suppose it's easier to do that than person to person?
Well, because it's probably a scheduled or planned or anticipated thing as opposed to a spontaneous.
And there's an agenda.
Sure. And but the point of connecting is what we have to stay focused on. You know, the opposite of sort of that emotional listening is fact listening. And that's where and this can happen with counselors. We think, okay, it's so critical that I get every little bit of information here. What do we miss?
Yeah, we're taking notes or...
Right, you miss the emotion behind the words. Yeah. Proverbs 14:13 says, even in laughter, the heart may be in pain. And so a lot of people use humor as a deflection for pain. So that's a great scripture to think about. Now, we might be so focused on the laughter, the verbal expression. What are we missing? We're missing the fact that the person's heart is in a great deal of pain. And so we have to learn to listen with both our eyes and our ears and our spirit to pick up all those pieces.
Message, mood, and meaning really is a good synthesis of what we're trying to communicate in terms of listening that makes a difference in a relationship.
Yeah. Another one is what I call speaker-centered listening. You're going to have clients who are quirky, strange, odd-looking, odd-smelling, dressed funny.
Now, are those in the DSM?
No.
Those are your own descriptions?
Yes. Just having seen lots of clients. And so
true,
what happens is there's some aspect of the client that's so distracting to you. I had a teenager who was referred to me, a court-ordered counseling, and he came in and he had lots of affirmation and identity issues, as you might imagine. But he came in and he had, I'm not kidding, somewhere around 150 piercings on his face. I'm not just talking about one lip ring, I'm talking about a whole row. Not one or two earrings, but maybe 20 on an ear. All the eyebrows, cheeks, it was so distracting. I had to catch myself from just not staring at him. Yeah. And then I realized, no, he has a story to tell. Yeah. But sometimes we can be so zoned in on the client or some aspect of the client. Again, we're not listening to story. Another one would be too deep for me.
That's good.
If you ever, this used to happen to me during stats class in college, and the professor would be droning on about Z-scores and T-scores and, regression analysis, and I would you just sort of tune out. And that's when information comes so rapidly, it's so full. What do we tend to do? Click. And so I'm like, it's too fast, it's too much, it's too complicated, so I've tuned out. And then all of a sudden, I miss an important piece of information. Yeah. And again, you're going to hear us say it again and again. Listening is an active process.
Could our students even practice that now when they're watching a video class? In other words, just what you're saying. If the information's coming to them, there's other distractions where they're in their living room or wherever they're watching this, honestly, they could practice zoning in and to see qualitatively the difference.
So. Right. I mean, depending on how you're watching this, you could be watching it on a television or a computer where you have people walking by, you have other noises, someone could be calling in or texting you on your cell phone.
Split screen watching football. I mean, there could be things that distract you.
Sure it could be. Sure it could be. But listening is an art. Dr. Ken's talking about you know, the mode, the message, the mean, you know, all of those things are important factors in counseling, because there's the message that the person intends to convey. So usually when someone's trying to communicate something, they know what they're trying to say, at least within that.
Yes, of course.
And then there's the message that they verbalize, you know, what comes out. And then there's the message that the person's body sends with it. And we'll talk about those nuances in a second. And then that's all on the sending end. And then the receiving end is taking in that message and trying to understand what they hear and then respond. I think a great picture is like a fax machine, if you think about it. You stick this piece of paper into a machine. The machine reads the message on the paper and then translates it into a digital language. Sends it out into, you know, from one point to another point, and then another fax machine receives that digital information, interprets it, reconstructs it into a message, and sends it out to the... That's a good picture.
It is.
And so think about it. Yeah. Communication can break down at any point along that process. So we have to, as we listen to people's story, and especially as we communicate with them, we have to pay attention to content and the process. So skills and techniques is about process. Why? So you can zone in and really understand content. One of my life-themed scriptures comes out of Proverbs 15:2. And it says, wisdom, here's that word again, wisdom, or some translations say the tongue of the wise, makes knowledge acceptable. Now think about that scripture for a minute. Wisdom, the tongue of the wise, or wisdom, makes knowledge acceptable. What's knowledge? It's something we know. It's something I read, something I saw, something that I experienced. It's my own thoughts and feelings, right? Mm-hmm. So as someone's trying to communicate what they know, the knowledge, okay, what makes that knowledge acceptable? So if knowledge is the what part of communication, then wisdom is not the what, but the how. Wow. And also the timing. I've learned that it doesn't necessarily always matter if I have the right message. If you're a parent and you have more life experience and wisdom than your kids, you've probably experienced sometimes you're trying to share a thought of wisdom with your kids and it's like, no, this is not coming through for some reason. It's not enough just to know what to say, but how to say it. Let me give you an example and then I'll pass it back to Dr. Ken. Let's say my wife and I are out at the mall and we're just sort of walking around window shopping, and she stops in front of a display case at a jewelry store, and she's starting to ooh and ah, and so I walk over, and she's looking at a pair of earrings. And I look at the price tag and gently take her by the arm, and we continue walking. But I now have knowledge, don't I? What knowledge do I have? Well, the knowledge I have is that she really likes those earrings. So let's say I buy the earrings for her. Well, that's a good thing to do with that knowledge, and all the wives would probably say amen. So I buy the earrings based on my knowledge, and I put them in a nice box. I wrap them in pretty paper, put a nice bow on it, and as I'm presenting to her what I know she wants, I take that box of earrings, nicely wrapped with a bow, and I throw them at her. They bounce off her face, and I go, there's your earrings. Now, I've never done that before.
Oh, well, yeah, I'm sort of glad to hear that.
But the focus probably shifted off
You've
of...
You've never brought jewelry before?
No, I didn't say that. I've never thrown anything. So the focus at that moment, if that were to happen, the focus shifts off of content, what's in the box, to the process, to the delivery style. And so you'll pick this up. A lot of clients are having difficulty in their marriages and their families and at work and in life relationally because their communication is not balanced and healthy. So their delivery style is horrible, and so you'll be working with them, just trying to teach them and give them some help on not only understanding the content of what they have to share with other people, but the process as well. But that works for you and I as counselors too. We have all this content. You know, you're going through counselor training and classes, and I have so much to give you, but if we're not tuned in to what else is going on non-verbally or whatever, and our delivery style as a counselor is poor, we in essence could be like taking that box of earrings, throwing them at the client. They're bouncing off the client's face, and we're going there's the truth. Now, but that's not enough to do something with it.
Again, from our textbook, a general guideline for deep listening is that there is no rush to action. It is a patient process.
I like that.
A metaphor for this is the idea of standing still for a few minutes with a client instead of running forward with great speed. And I know for someone like myself, the tendency would be to think ahead, to know where we need to be going, at least my bias to where we need to be going. And it brings up the question that's awkward for beginning counselors many times. What do you do in the counseling relationship, or perhaps marriage? How do you interpret silence? Have you had to deal with that from time to time? You know, when I went through my graduate level training in my counseling, sometimes a counselor would be sitting there together, and the counselor would just sort of, and it was obvious he wanted something, but I didn't know what the script was. So how do you interpret silence?
I was just going to say, silence is a great tool to use, especially with nonverbal clients. Now, some might just sit there and enjoy the silence, but let's just try a little something right here. Dr. Ken and I, we're gonna look at the camera together, and I'm just gonna we're gonna look and not say anything for a second. So, Dr. Ken, let's just look at our audience for a minute.
Can we just stop at 30 seconds?
Do you sense almost like the tension building? It's like,
yeah.
Well, say something, what's going on? And so silence can actually be an effective technique sometimes, and it's not so much, sometimes we as counselors, or young counselors, inexperienced counselors, get uncomfortable with silence and feel like, I have to fill the void, like I have to say something.
Yes.
Not necessarily. So sometimes, listen, God gave us 2 ears and 1 mouth for a reason. I don't know if that means we're supposed to listen twice as much as we're supposed to talk, but I think there is something in the design of that. So,
and our discomfort with the silence is so apparent to them. So we, as counselors, we forget there are 2 very intelligent people in the counseling office. We assume somehow that they're not picking up on what we're saying or feeling or sensing in our nonverbal and verbal communication, but a moment of silence can be a very valuable source of information about the client. Sometimes, too, when there is a period of silence, we break the silence with a new question. We unfortunately disrupt the process by heading a new direction. Sometimes beginning counselors do what I call, they chain questions. Well, what do you think about this? How do you think this is going to happen? Or we asked 3 or 4 questions at once, and the client doesn't usually say anything, but the countenance, the nonverbal feedback is, well, which of these questions do you want me to respond to? So silence is not an obligation to change the subject, assuming that they have run out of thoughts about what is very important to them. It can be just the opposite. Silence can say, wow, I want to process where we are and what we're talking about now. Now, the textbook gives us 4 specific, well, actually probably 6 or 7 specific things that are listening responses. Maybe we could at least list these and talk through them, and if we think of an illustration. The first one is helper clarification.
Right. Clarification typically conveys to the client that you have interest and that you are encouraging them to continue with story. So, a nonverbal clarification technique is something that maybe you've watched Dr. Ken and I do as we're listening to each other, and he's doing it right now. What is he doing? He's just nodding his head. When someone is talking and the other person's just sort of nodding their head, it says to the one who's talking, oh, you're listening to me, you're tracking, you must be getting something at some level because you're nodding.
Yeah, right.
Doesn't necessarily mean agreement, but another clarification. Sometimes you hear this, okay, those are sort of like, tell me more. I'm wanting to get more of your story. I'm wanting to get a better clarification of your story. You could say, well, that's interesting. Clarification things are things that encourage and motivate the person to continue.
And my
to share.
style typically is I always not play the role, but I always behave like Columbo. I always sort of scratch my head and look confused. And I'll say to a client, I'm not sure I'm tracking you. And then watch this. I'll say, can you help me understand better what you're saying? Well, what that does, first of all, that validates. It's a gift, the gift of listening and asking for clarification. And I'm telling you, the motivation for a client to help this poor counselor out, that's the way it works. They think, well, bless his heart, he may be well trained, but he's just not picking this up. So it's a kind way of inviting them to participate in the clarification process, because if you don't get it right, then you're going to have multiple detours that distract from your success.
So what clarifying does, and clarifying statements and nonverbal gestures do, it tells the client that you matter. Yes. And your story matters, and it has value. And when you can convey a message of you matter to God, you count, your life is important, all those things, what it does is, again, it begins to create the environment that encourages a person to unpack their pain and deal with that. So another skill is, what's the second skill?
Helper paraphrasing. So the counselor paraphrasing what the client is talking about.
Right. So paraphrasing, or sometimes it's also referred to as restating. And it's not just parroting back. You hear sometimes counselors, hear
In fact, we should role play that.
So what I hear you saying, Dr. Ken, is, well, I'm not saying be that robotic, but paraphrasing or restating is a way to show that you're listening and you're understanding the facts. You're getting the content of the story or the message. And so you're putting it maybe into a similar, your own words. But that's what's going on.
And paraphrasing actually broadens the scope of the communication and the interaction. Because if you paraphrase and you're not precise or you're not quite on target, you can see that in their nonverbal feedback, and they will graciously say, well, no, that's not quite what I had in mind. And isn't paraphrasing probably not quite at the same level of listening, but if you really are good at paraphrasing, it becomes a lubricant in a difficult situation to move to the next level.
Actually, if you think about it, I see this, I've worked with couples, the inability to paraphrase, which sends the message to the other party, you don't understand me, is often behind an escalating conflict or conversation that leads to an argument. Because if you have two people talking to each other that have important things to say and there's some emotion in the topic, and each party is feeling inside, I don't think they're getting it. I don't think they understand. Then what happens is sometimes people think, well, maybe if I say it a little louder, maybe if I say it a little stronger, a little more intensity, they'll get it. But if both people are at the same place, then you just have this escalating emotional thing that becomes an argument. So I often say this, understanding does not take place when you as a counselor look to the client and say, I understand. Understanding takes place when the client's head is going up and down. As you're paraphrasing, as you're trying to say, okay, this is what I think I'm hearing you say, or this is my understanding of what you just shared with me, and the client is going, yep, that at that point, the counselor, the client is feeling like, wow, this counselor understands me, and tension tends to drop. Anxiety tends to drop, and people are relaxed. We've talked about relax, so you can relate and respond. So you want the client to relax, you do that by paraphrasing and restating story. And
Dr. Eric, what you just said was so important in terms of the context of the counseling situation. You didn't say, your paraphrase wasn't, well, what you're saying is, you used you gave an invitation. You said, hey, I'm not sure I'm understanding, or I want to make sure I'm tracking you. It's a gracious way of restating it. And in a marriage, what happens is the grace dimension is missing, and the wife or husband will say, well, I can't believe, yes, this is what I'm hearing, this is what you said, and then you lose the message.
Let me say this again, understanding does not mean agreement. So just because you paraphrase or restate a client's position doesn't necessarily mean you agree with that position. Remember, clients come in with different worldviews, different value systems, different beliefs. It's not saying, I agree with your position. It's just saying, okay, I get it. I get it to the point that if I had to go tell another party what your position is, I think I could do that pretty accurately. That facilitates ongoing progress.
I think it's important for us to understand that these particular specific suggestions we're making have to be blended and appropriately applied. They're all important. And the next one I'm going to ask Dr. Eric to give us some direction on. What's the difference between paraphrasing and reflection? Because another listening skill is called reflection, and how important it is.
Yeah, this is another critical skill, and these are close, but there's a little nuance difference between restating or paraphrasing and clarifying. Reflection is I'm giving back to the client not just the words that they're saying in the content or the message of the story, but at least I'm trying to probe and say, am I getting the feelings? Am I getting the emotional content in between the lines and behind the story? So for example, let's say a client is talking about a recent loss, or maybe not even a recent, perhaps they lost a loved one some years ago, and they're talking about that. And as they're talking about it, you're saying, so wow, so what happened is that your cousin died in a horrible car accident, and you were sort of like your cousin's mentor, and you all were very close and coached him a little bit in some baseball. So I'm giving back, I'm paraphrasing, restating content, and then I pause as a counselor and I say, I can see that there's still a lot of pain in that experience for you, and there almost seems to be some anxiousness in your heart about losing another family member. Now, the client may not have said that, but that's where me as a counselor, I'm beginning to probe and say, let me see if I'm picking up some of the emotional content between those words. Now, when you can combine paraphrasing or reflecting, paraphrasing and restating with reflecting, there's something that's just phenomenally powerful about that dynamic, because the client will go, they get it. They understand me, and they understand me at multiple levels. We work a lot with couples and in families to try to help them to understand that process, because it changes the dynamic in a conversation and subsequently in the relationship.
And interestingly enough, it so validates them that you are, because see, they're insecure many times about how they feel and how they see things and how they're dealing with issues of life. And for you to sit there and say, to both through reflection and paraphrasing and focused attention with listening, and then you are right at the core of what they're struggling with. There is nothing more glorious for the client to go, oh my word, he gets it. And not only does he get it, he empathizes and understands where I am and what I'm dealing with.
And it's not, again, let me say this, reflection does not necessarily mean I agree with where the client is emotionally. I might see their anxiousness or their fear as debilitating, as interfering with life. But it's not at that point a critical judgment on either the content of the story or the emotions behind the story. It's just saying, I'm hearing you, I get it from your perspective, and so I can empathize. Remember, empathy is I'm focused on what the other person's feeling. Sympathy is I'm focused on what I'm feeling. All of that sets the tone for progress and movement from a position where a client may be stuck and getting them to move toward a healthy kind of thing. So what's the fourth critical skill?
Well, it's referred to as helper summarization. Obviously, that fits within a certain time frame in the context of the overall scope of your plan, but it is very, very helpful, I think, from time to time in the dialogue with a client, from time to summarize what's going on in the counseling office. So
and again, summary statements are often made near the end of a session, and it's helpful for the client because client's emotions can be all over the place. You might have talked about a number of different things related. It's not unusual for a client to come in and and if I can use the phrase, sometimes it's like verbal diarrhea. It just comes out. And so there might be all kinds of things. So it helps a client to say, all right, let's sort of summarize. I've even said, let's kind of summarize what we did this session, what we talked about, and where we're going. And so the ability to summarize, which means what? You have to be listening the entire session. You have to be taking some mental notes. Now, we talked about A, B, and C, feelings that were going on here. We talked about these possible things happening when the person leaves the office. So you have to track all that information well. That's, again, why listening is an active process. It's not passive. You have to be filing that away. So near the end of the session, you can summarize for that client, bring it into a nice package for them so they can have some closure and feel like, okay, I know where I started when I walked in your office. I know where I'm ending. I have a plan, between now and the next time I see you.
A summary statement is so affirming to the client for the reasons that Dr. Eric just suggested, that I have been with you, I've tracked it, I know what the most important points are. So it reinforces the direction that the counseling relationship is taking and the counseling goals as we are pursuing them. Sometimes in my work, I will say, initially in the intake interview, look, after 6 sessions, we're going to have a conversation together about, is what we're doing working? Are we moving in the right direction? Or do you have a sense of accomplishment and satisfaction? But it's important from time to time to do an evaluation and an assessment of the process, but from week to week, do that summary. Because sometimes the people that we work with, Dr. Eric, they're lacking in cohesiveness. They're lacking in connectedness internally. And so for them to hear a voice that they pursue, a voice of authority saying, hey, this is what's going on. This is what we're trying to accomplish. This is what I heard you say today. And I'm really looking forward to the time that we meet again so that we can follow up on some of these things.